we'd like to give a message to all of our current private patients and just give you a little bit more information about things that are happening at Queensway at the moment. We have been able to remain open for the last 8 weeks, and we've been just seeing emergency patients that have been carefully triaged to sit in with government guidelines. We hope at this time, after 2 months of lockdown, that you're all staying safe and well. We hope we've been able to get in touch with those patients that have got any problems, and we hope that you've been finding access to our team as good as possible at this time. We would like to update you on some of the things that have been happening, some of the practice developments and some of our future plans. Things have changed quite a lot in the last 8 weeks, and we would like just to quickly go over a few areas about who we can see, how are we going to do this, what's changed, when will we be open, and how can you contact us. And I'll let Paul take that a little bit further.
Thanks, Ian. So, yeah, as Ian's mentioned, currently the advice we've received from the government, the Department of Health and other regulatory bodies is that unfortunately we can't provide any routine dentistry at this time, and that's because of safety both to our patients and to the dental team. As Ian said, we're really pleased that we've been able to stay open over the last 8 weeks though to treat emergency cases. That's been managed through kind of telephone triage with our dentist and nurse team, giving advice and guidance over the phone where we can, and then if it's absolutely necessary, seeing people for face-to-face treatment to do things to, in the main, get rid of their dental pain. This has been really good, and our teams work really hard to be able to achieve this. We've invested in some additional personal protective equipment to keep everybody safe, and also adopted some new protocols and procedures within the practice to make sure that we can keep everybody as safe as we possibly can during this tricky time. And they're things that probably will remain with us after this time, and we'll certainly keep people in touch with that and give them an idea of how things may develop when they're able to return to the practice. I'm going to hand over to Ian now. He's going to talk a little bit about how we're managing the appointments that we did have scheduled through the month of June, and then we'll let you know how we're going to manage those moving forward.
So going back to March when we had lockdown, we moved patients into early June, and at the time that felt like a long way away. We are now at that point where patients are starting to think about coming back to the dentist, but unless you're having symptoms, unless you've got a problem, those appointments can't happen at the moment. We're going to try and speak to those patients that require our attention, and we're going to be continue to be available for patients for urgent and emergency care. At the moment, there is some communication going to come out by post, email, or by contacting the staff, and that will explain that appointments will be moved further into the future, and then we'll be in touch with you as soon as we can. You can contact us still. We are open. We have receptions here every day. There is email, dental@queensway.co.uk. There is our telephone number 01642 554 667, and if you go to our website, we have a chat box, and the nurses are trying hard to keep on top of the contact that's coming in from chat as well.
Just like to finish by saying we're so grateful for everybody's patience and understanding during this time. We know it's been difficult for everybody in lots of different ways, and we'd love to be able to give you much more certainty and clarity at this time, but unfortunately that's just not possible. As Ian said, please don't hesitate to get in contact with us if you've got a problem. We'll try and get regular updates out through our social media channels, so if you've got the opportunity, follow us on Facebook and Instagram and on our website, and regular communications through email as well. So we'll keep in touch as best as we can. We can't wait to when we can welcome you all back to the practice, and we hope that's very soon. And we wish you all the very best at this time. Stay safe, stay well, and we'll see you soon. Thank you.
Take care.